carry on with the head and neck lectures, I'm gonna discuss in this presentation the anatomy of the tracheopalatine fossa and its contents. I'm Dr. Dalia Saleh, Professor of Anatomy at Mansoura University, Egypt. And now with the anatomy of the maxillary nerve. This is the trigeminal ganglion, which lies in the middle cranial fossa. It has three divisions: the ophthalmic nerve, the maxillary nerve, and the mandibular nerve. And this is the trigeminal nerve. The maxillary nerve, which is the second division of the trigeminal ganglion, is a purely sensory nerve. It leaves the skull through foramen rotundum, which opens into the posterior wall of the tracheopalatine fossa, so we can see the maxillary nerve passing into the tracheopalatine fossa, and then it will leave the tracheopalatine fossa into the orbit by passing through the inferior orbital fissure. It passes there through the infraorbital canal and then appears on the face from the infraorbital foramen as infraorbital nerve. So basically we can divide the course of the maxillary nerve into four parts. First, it passes in the middle cranial fossa, and then it appears in the tracheopalatine fossa, and then in the orbit in the infraorbital canal, and then it appears in the face as infraorbital nerve, which is the terminal branch of the maxillary nerve. In the middle cranial fossa, the maxillary nerve gives meningeal branch to the meninges of the middle cranial fossa, and then when it is in the tracheopalatine fossa, it gives ganglionic branches. Also in the tracheopalatine fossa, it gives the posterior superior alveolar nerve, which pass over the posterior surface of the maxilla, pierce it into many holes, and enter the maxillary ear sinus to supply its mucous membrane, and share in the upper dental plexus. It supplies, beside the maxillary ear sinus, the upper molar teeth. Also in the tracheopalatine fossa, the maxillary nerve gives another branch. It is called the zygomatic nerve. The zygomatic nerve enters the orbit through the inferior orbital fissure and then split into two terminal branches: the zygomaticotemporal nerve, which supplies the lateral side of the temple, and zygomaticofacial nerve pierces the zygomatic bone and supplies this area over the zygomatic bone in the face. Inside the orbit, the maxillary nerve gives the infraorbital nerve, which enters through the infraorbital groove and the infraorbital canal. So it passes here in the floor of the orbit, and it gives the middle and the anterior superior alveolar nerves. They supply the mucous membrane of the maxillary sinus, and together with the posterior superior alveolar nerve, they share in the formation of the upper dental plexus, which supply sensation to the upper teeth and gum. Finally, the infraorbital nerve emerges through the infraorbital foramen and appears on the face and split into too many branches like the palpebral, the lateral nasal, the superior labial, and supply a major area in the face here. This is the end of my presentation. Thanks for listening. If you like it, please do not forget to subscribe, like, and share, and do not forget to hit the notification bell so you will be notified if I upload another video. Thank you.